Patient is in bed complaining of abdominal pain. The nurse enters the room, doesn't provide privacy or acknowledge the patient while looking at her chart. So you claim your stomach hurts, says the nurse. Patient, yes, it is cramping and tender. I haven't had a bowel movement in 3 days, but I usually have one every day. Nurse, that sucks. I need to do my assessment of your bowels, so now lay back. The nurse palpates abdomen roughly, auscultates the heart. Sounds good. I'll give you some pain medicine so you'll stop being a boob and go to sleep. Our patient is in bed complaining of abdominal pain. The nurse enters the room, provides privacy, and acknowledges the patient. The nurse introduces herself and asks how they are doing. The patient responds, "My stomach is cramping and tender, and I haven't had a bowel movement in 3 days." "How often do you usually have a bowel movement?" the nurse says. Patient replies, "I have one every day." Nurse, can I listen to your abdomen so I can further assess what is happening? Patient agrees. The nurse auscultates the abdomen, palpates, and notes abdominal distension and tenderness and pain. The nurse then explains, "We will give you pain medication and some docusate sodium. Docusate sodium helps with constipation." The nurse checks the orders against the medication and the patient and administers the meds, reminding patient to drink lots of water and to walk when they can. The nurse documents, provides for safety, performs hand hygiene, and tells the patient she will check on her again later. 3 to 5 hours later, the nurse returns. Provides privacy, does hand hygiene, verifies the patient, and the patient has had a bowel movement.